And welcome into To Your Health. And everybody, you know that February is Heart Month. And that is that organ that keeps you going. So you have really got to take care of that. And last week, Jack talked to Dr. Cook. We are so happy, Dr. Bill Cook, William, formally, but you're a cardiovascular surgeon, and you are new to Montgomery, but folks, I love this. He has been here in the past, loved our place, our town enough, and Baptist to come back. And so we are so fortunate to have you here.
Glad to be here.
Welcome back home.
Oh, thanks. Thanks.
Last week, we talked about the things that as you age, your heart ages. Well, once you find out that you do have a problem, then next, they're going to come to you. And let's talk about exactly what you do.
Well, I do open heart surgery. So I was talking last week about the reasons to get open heart surgery when you're sort of beyond the stent phase. The people with 2-vessel or 3-vessel disease or complex disease that can't be stented. And sometimes valve disease as well, but that's a little bit separate than the blood vessels. But all leaky valves, we can fix with open heart surgery as well.
Okay.
Another reason that people can get shorter breath if they start leaking. Just like arteries, valve leaflets can get hard as well. But when I do open heart surgery, so I, open the chest and put people on a heart-lung machine so that I can stop the heart and it can be still, and I can sew new blood vessels on to go around blockages or open the heart and fix valves. And we also do some surgery for atrial fibrillation now. There's a clip we use a lot that decreases the risk of stroke after heart surgery for the lifetime. In people who are who have heart disease, they're at a little higher risk over lifetime, and it looks like this. We've had a couple of very big studies that show that it decreases the risk of all-cause stroke. So there's a number of things we do while we're fixing the blood vessels. So
since you're in there, you take a good look and see what needs to be worked on.
Yes, yes.
I love that, because you don't want to be opened up any more than you have to.
Right.
You know what we were talking about earlier off camera. Don't function from fear out there that you might have something wrong, you've got a few symptoms, but you don't do anything about it. Don't do that, because it is not like it used to be. And open heart surgery, it was like you knew you were just going to die. I'm serious. It was 20 years ago, it was one thing. Now it is not like that. And we have made so much progress. Tell us, like, the recovery period, the length of time for the surgery, all the different tools that you have.
Yeah, well, we've done so many of them. They do about 300,000 open heart surgeries a year in the United States.
Wow.
And so we've got a lot of data about it and figure out, and we have these big databases, the Society of Thoracic Surgeons database, where we can look at different patients and how they do. And so we can get good risk for everybody, and it turns out it's getting lower and lower risk every year.
Great.
We use less and less blood transfusions. It just, we get to cheat. When you're on the heart-lung machine, any bleeding people do, we can suck back out and put into the machine and give back to them. So
I love that.
It's a little different than
how
we started. But most people, the surgery takes between 3 and 4 hours. For the patient, it's a 5-minute nap. The family's doing all the waiting and worrying the day of surgery.
That's true, Bill.
So we call out to let the family know how things are going. But after the surgery, most people are only on a ventilator for about 2 to 6 hours after the surgery.
Okay.
And that's because all the anesthesia that's good for your heart lasts a long time. So we can't use a lot of the gases that they use for tonsils where people wake up immediately, because that gives you more rhythm problems.
Okay.
So we use IV medicines that last a long time. That's the only reason that people wake up a little bit later after the surgery.
That's interesting.
Yeah, and so but we try to get them up and walking by the next day. It's better to be up and moving than not. Your kidneys release different hormones. You start getting rid of the extra swelling that's happened from the surgery. And so moving's always better than not moving. And so we get people moving, and usually between 3 and 5 days, they're ready to go home after the surgery.
After open heart surgery?
Mm-hmm. Yeah.
Wow. That in comparison to what so many of us were used to coming up, that is just a godsend, honestly. And I love the fact that your risk factor is so much lower, and actually, once you've had all that done and corrected everything, can you kind of expect a pretty normal lifespan after that, or how does that work?
Yeah, surgery is a really good long-term fix for blood vessel disease. So the internal mammary artery we put is an artery on the inside of your chest wall, connects all the blood vessels under all your ribs, and it fits perfectly to the main artery on the front of your heart. And 93% of those are open 13 years down the road. So I mean,
wow.
So it's a good long-term fix. With vein grafts, about half of them are still open 13 years down the road.
That's incredible. Do you do most of your you do all of your surgery at Baptist, I assume?
Yes.
Are you at Baptist South?
Yes, Baptist.
Because they are probably premier in our region for anything that has to do with the heart. I mean, that's where I would go.
Yeah.
I would be directly to Baptist South.
Excellent.
We are so thrilled to have you, and I want to end it with one thing. If you could give us 2 specific things that would help to keep us from having to have what you do, what would they be?
Well, 2 specific things. I guess everything in moderation is a good way to put it. Being male and living in America are 2 risk factors you can't get rid of. I have those, right? But smoking, watching your blood pressure, and watching your cholesterol. I mean, all these things add up to heart disease. That's
Gotcha.
how the pipes get clogged. And so when we talk about healthy lifestyle, that stuff matters. And if you're diabetic, you really need to watch your sugars. But those things that you can control, you need to control.
Right.
And exercise a little bit. We tend to eat too much in America. We don't work out in the fields where we can have a steak and egg breakfast and miss lunch, and we've used 3,000 calories. And so I wish I had 2 quick ones, but there's more than that. It's more complicated.
Well, that helps us a lot to understand too. And folks, take care of yourselves. Take care of your own health and be responsible. Don't wait. Go get your heart checked. And
Definitely.
then we thank you again for being here. Thanks for sharing with us, and thank you for all the lives that you've saved.
Well, thanks.
Thank you.
Appreciate it.
And we'll be right back.